COVID-era telehealth flexibilities are extended by the DEA. Physician lawmakers raise concerns over private insurance policies. And a must-pass defense spending bill is signed into law. For the week of January 5th, 2026, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth. Kicking off the first episode of 2026 with news from the administration, where the Drug Enforcement Administration has extended COVID-era telemedicine flexibilities for the prescribing of controlled substances through 2026. The flexibilities allow for the prescribing of controlled substances without an initial in-person visit through December 31st of 2026. The policies were set to expire at the end of 2025. This is the fourth temporary extension of these flexibilities. The extension provides time for the administration to implement the expansion of buprenorphine treatment via telemedicine encounter and continuity of care via telemedicine for Veterans Affairs patients' final rules, and for practitioners to comply with the two final rules' new requirements.
How long has it been? Shall we get into it again? Excuse our disgrace. We've had no time to paint the place. The dog is always barking at the mailman. I won't waste your time.
This is over $900 billion of money that we can send to our warfighters and to our military families. There's a large chunk of that's dedicated to ships, submarines, aircraft, the actual warfighting resources and tools that we need to just exemplify peace through strength throughout
President
the world.
Donald Trump has signed the fiscal year 2026 National Defense Authorization Act, or NDAA, into law, following months of negotiation between the two chambers of Congress on a compromise version of the must-pass annual defense policy bill. The law includes a provision that will bar Chinese biotechnology companies of concern from receiving federal funding. A previous version of the legislation, known as the Biosecure Act, was omitted from last year's NDAA due to concerns about naming specific biotech companies to be scrutinized. The final NDAA would require the Office of Management and Budget to create a list of biotech companies, like those on the Department of Defense's list of Chinese military companies, that would be blocked from federal contracts, grants, or loans, and to provide the companies the opportunity to appeal. Shifting to news from Congress today, where members of both the GOP Doctors Caucus and the Democratic Doctors Caucus have written to the U.S. Department of Health and Human Services regarding Anthem Blue Cross Blue Shield's facility administrative policy, which penalizes hospitals that enable patients to use out-of-network physicians. The lawmakers argue that the new policy undermines the No Surprises Act's Independent Dispute Resolution, or IDR, process, and places hospitals in, quote, an untenable position, either compel physician groups to accept reimbursement that cannot sustain high-quality operations, or restrict their patients' access to high-quality clinicians in order to avoid being penalized by Anthem, unquote. The letter calls on HHS to investigate the legality of this policy and to, quote, question Anthem's networking tendencies to better understand how they engage, or fail to engage, in network negotiations with providers, unquote.
And their economies. The old Washington approach was to throw money at failing systems, patching holes without fixing the foundation. That failed, and rural America paid the price. President Trump is changing all that. In the One Big Beautiful Bill, Congress created a Rural Health Transformation Program. This is a bold new approach, $50 billion across all 50 states.
Winding down today, where the Centers for Medicare and Medicaid Services has announced $50 billion in awards under the Rural Health Transformation Program, which was established by the One Big Beautiful Bill Act, the Republican reconciliation law from 2025. All 50 states will receive awards ranging from $147 million to $281 million in 2026. The $50 billion provided under the law will be distributed over 10 years. The program was included in the legislation to address concerns of Senator Susan Collins, a Republican from Maine, and other Republicans who were worried about the potential impact of the legislation on rural hospitals and individuals living in those areas. Final news today, where the Government Accountability Office has released a report on the initial distribution of new Medicare-funded physician residency positions. The Consolidated Appropriations Act of 2021 required CMS to distribute 1,000 new Medicare-funded graduate medical education residency positions to qualifying hospitals through permanent increases to their resident caps. To date, CMS has allocated 600 of the 1,000 new GME positions to hospitals during 3 annual distributions. Most slots went to urban areas, and about half supported primary care. Approximately half of the 393 hospitals that applied received positions.
Good morning and welcome everyone to the organizational meeting for the 119th Congress.
And I welcome everyone to the first Health Committee meeting of the 119th Congress.
Good morning and welcome everyone to the first meeting of the House Committee on Energy and Commerce of the 119th Congress.
The Finance Committee will continue its long tradition of addressing these matters in a manner that invites bipartisanship.
We end each week's episode with the call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. The first and only health-related meeting currently on the calendar will occur on Thursday, January 8th at 10:15 a.m., when the House Energy and Commerce Subcommittee on Health convenes a hearing titled Legislative Proposals to Support Patient Access to Medicare Services. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.